So, let's talk about what happens when the future of a public hospital gets decided behind closed doors. This is a story that's unfolding in a small corner of Washington state, and it's got everything. A secret deal, a whistleblower commissioner, and a really big question at the heart of it all. How much do we, the public, actually have a right to know? You hear that, right? A figment of his imagination. That's a pretty firm denial from one of the hospital commissioners. A total, flat-out rejection of any secret meetings. But here's the thing. What one person calls imagination, another person calls a violation of public trust. And they've got the internal documents to back it out.
Okay, so before we dive into all the drama, you gotta know who the players are. Because to really get what's going on here, you need to understand that this isn't a fight between strangers. No, this is more like a family feud between two hospitals that have been working side by side for years. All right, so meet Jefferson Healthcare and Olympic Medical Center, or OMC as folks call it. For decades, these two have basically been the backbone of healthcare in their rural community. Recently, they decided, hey, let's see if we can work even closer together. They launched this project, codenamed Project Driftwood, to explore a much more formal alliance. On the surface, it sounds great, right? But the way they went about it, well, that's where our story really begins.
And that brings us to the moment where this whole thing just ignited. It all comes down to one single closed-door meeting. A meeting where a huge, game-changing proposal was on the table, while the public was officially told it was about something else entirely.
I mean, the contrast here is pretty stark. On February 5th, the board holds an executive session. That's the official term for no public allowed. The reason they put on the books? Real estate. Pretty boring. But according to the documents that later came out, the real topic was this massive proposal to create a whole new Peninsula Health Alliance with OMC. So, yeah, not exactly about buying a piece of property.
And here's the detail that really lit the fuse. 7-5. That was the proposed split for the new governing board. 7 members from Olympic Medical Center and only 5 from Jefferson Healthcare. For a community that's really proud of its local hospital, the idea of just giving up majority control, yeah, that was an absolute bombshell. So as you can imagine, this secret plan didn't sit right with everyone in that room. And this is where one commissioner, a guy named Matt Reddy, decided he couldn't just stay quiet. He had to act. And that decision put him on a direct collision course with the rest of the board. For Commissioner Reddy, this wasn't just about some minor rule. It was a matter of principle. As he put it, he would not be complicit in deceiving the public. He felt the board was deliberately keeping people in the dark about a plan that would change their hospital forever. He just couldn't be a part of it. And he didn't just get mad. He was really methodical about this. First, he went to his colleagues and straight up told them he thought the meeting was unlawful. Then, he got his own legal advice. And this part is key. The lawyer confirmed that using the real estate excuse for something like this was likely a violation of the state's open meetings law. And when his warnings were ignored, he filed official complaints with the sheriff, the state auditor, and even the Bar Association. He took it public. Well, once those complaints were filed, the cat was officially out of the bag. The issue was forced into the open, and suddenly the board's story started to change. It went from total denial to a much more carefully worded admission of fault. But that only happened after the press got involved. At first, the official line was to downplay everything. You can see it in this quote from another commissioner who said they just talked about some possibilities. Just spitballing ideas. But that sounds a whole lot different than the formal, detailed proposal that Reddy knew they had discussed. And this is where local journalism becomes the hero of the story. The Port Townsend Leader newspapers started digging into the claims. They listened to recordings, they investigated, and then bam, they broke the story wide open, dragging the secret proposal out of the shadows and into the headlines. With the story out and public pressure building, the board had to change its tune. They released a formal statement saying they inadvertently exceeded the narrow permissible scope of the meeting. That's a very bureaucratic way of saying, oops, we messed up. So no, it was definitely not a figment of anyone's imagination. Now, a controversy like this doesn't just stay in the boardroom. Nope. It spilled right into the next election, turning a normally quiet local race for a hospital commissioner seat into this huge, high-stakes debate about transparency and how public officials should behave. So the controversy created a really clear choice for voters. On one side, you have the incumbent, Matt Reddy, whose whole campaign is about accountability and the public's right to know. And on the other side, his challenger, Stu Kerber, who's arguing that, hey, disagreements should be handled professionally.
not in a way that makes the hospital look bad. Reddy's position is summed up perfectly right here. For him, transparency isn't just some inconvenience you try to get around, it's the sunlight that protects us all. It's the core principle that keeps powerful people in check. And then you've got Kerber's take, which offers a different view on good governance. He says, look, it's healthy for boards to disagree, but how you handle it is what matters. The priority should be solving problems professionally, not having a big public fight.
So you see, this whole thing is so much bigger than just one meeting or one election. The entire episode raises these fundamental questions about how our public institutions are supposed to operate. It puts a specific state law and the ideas behind it right under the microscope. And this is the law at the very center of it all, the Open Public Meetings Act. Its purpose is really simple, to make sure that the people's business is done out in the open, and it has real teeth. Any action taken in an illegal closed-door meeting is considered null and void. It's like it never even happened. And all of this leaves us with one final crucial question. In a world where public groups have to negotiate complex deals, where exactly do you draw the line? When does confidential, strategic planning cross over into being an illegal secret that violates the public's trust? This case in Washington shows that the answer isn't always simple, but the fight to figure it out is absolutely essential.